TGen, where we're using advanced genomics to solve complex problems such as cancer and Alzheimer's. TGen North is the pathogen genomics division. In Flagstaff, we're using those same tools and technology, but we focus on infectious disease, the microbes, the bacteria, the viruses, the fungi that cause some of the greatest problems around. We didn't know then that we would actually be using those techniques now to help solve day-to-day disease outbreaks. When a fungal outbreak started to occur in pediatric cancer patients in South America, the Centers for Disease Control was called by South American health officials to figure out how it happened. Once they realized that this was a novel fungal outbreak, they contacted TGen, and we were able to step in and apply this next generation science to help them solve not only how were cases related, but what was the true cause of the outbreak, which turned out to be an anti-nausea medication that was contaminated and unfortunately ended up killing a number of kids. TGen really is a global leader. There's almost no one else that's had the experience working hand in hand with CDC and other health departments to be able to solve these outbreaks over the last few years.
COVID has changed our world immensely. Our world of work is almost exclusively COVID-19. It's about the community transmission and how to stop the spread, bottom line.
Within, a few weeks of us learning about COVID, we can go into these databases and pull down like 100 genomes or 1,000 genomes of this virus.
The tools, the technologies, the approaches that we are known for in cancer are those that we also apply to the genome of this virus.
With genomics, one of our goals is to really carefully map out not just individual samples, but trying to map out all positive samples in Arizona.
We can look at the virus genomes and be able to determine who may be transmitting to whom within the greater population.
So what's really unique about the work that we do here at TGen outside of our clinical diagnostic laboratory is that we have the capacity to do whole genome sequencing on the virus. So samples that test positive in our laboratory and samples that test positive at the Arizona State Laboratory come to us, and we have an amazing sequencing team that does whole genome sequencing on each of the viruses.
We've been working with governments and with businesses and trying to give them the information that they can use to move forward in the safest way possible for either their constituents or their customers or their employees.
The question is, what haven't they done? They've done so much. They've been with us from day one doing the processing of specimens. They've given us volunteers to work the blitzes. They've given us supplies when we didn't have any. They work weekends. Their turnaround time is wonderful. There's nothing that they don't do.